Begin the examination by introducing yourself and obtaining consent.
Encik Ahmad Fuad, saya akan periksa jantung Encik Ahmad Fuad. Boleh ke?
Boleh.
Okey. Jadi sebelum tu saya nak kena naikkan katil sekejap ya.
Make sure that the patient is properly positioned, reclined at 45 degrees, and adequately exposed. Observe the patient's surrounding for medical instruments, for example, the usage of supplementary oxygen and intravenous infusion. From the foot of the bed, inspect the patient's general condition, comment on the conscious and comfort level, body habitus, and nutritional status. Next, examine the patient's hands. Look for signs of cardiovascular disease such as finger clubbing, peripheral cyanosis, splinter hemorrhages, osseous nodes, and Janeway lesion.
Okey.
Palpate the radial pulse for 15 seconds to determine the rate and rhythm. Check for radial delay.
Okey ya. Nanti saya akan periksa nadi di sini dan di sini. Saya akan angkat tangan ya. Ada sakit ke mana-mana tak tangan? Tak ada ya. Okey.
Look for the presence of collapsing pulse by palpating the patient's radial pulse and raising the patient's arm above the head.
Sekarang saya akan periksa mata ya.
Now, examine the patient's face. Look for xanthelasma, corneal arcus, pallor of the conjunctiva, and scleral discoloration.
Okey. Sekarang boleh buka mulut? Boleh ya. Okay. Buka mulut ya. And keluarkan lidah.
Inspect the oral cavity for central cyanosis, dental hygiene, and high arch palate. Next, assess the jugular venous pressure. Jugular venous pressure is the vertical height of the internal jugular venous pulsation above the sternal angle while the patient is reclined at 45 degrees.
Saya akan tekan perut ya. Ada sakit ke dekat sini? Tak ada ya. Okay, mana sana?
If the pulsations are not obvious, this can be accentuated by performing the hepatojugular reflux.
Saya akan periksa dada ya.
Now, we examine the precordium. Inspect for chest deformities, surgical scars, and visible pulsation. Palpate and locate the apex bead. Normally, the apex bead is located at the fifth intercostal space in the mid-clavicular line. Palpate for the parasternal heave, which indicates right ventricular hypertrophy. Next, feel for trills and palpable heart sound at the base of the heart. Trills signifies palpable murmurs.
Boleh alihkan kepala ke sana. Okey.
The bell of the stethoscope accentuates a low-pitched sound, whilst the diaphragm augments a high-pitched sound. With the bell, auscultate at the mitral area for the soft mid-diastole murmur of mitral stenosis with the patients in the left lateral position. Now, with the diaphragm, auscultate over the mitral, tricuspid, pulmonary, and aortic areas respectively for the heart sound and presence of any murmur.
Okey.
It is important to time the heart sounds with the carotid pulse in order to differentiate the systolic and diastolic murmurs. The right-sided murmurs are accentuated when patients holding the breath during inspirations. The left-sided murmurs are emphasized when the patients holding their breath during expirations.
Hembus. Tahan. Okey. Sekarang saya akan dengar di bahagian leher, ya. Okay. Tarik nafas, tahan. Hembus.
Next, auscultate the carotids for presence of bruit.
Tahan. Hembus. Okey. Sekarang saya akan dengar di belakang cik, ya. Tarik nafas.
Auscultate the lung bases posteriorly for inspiratory crepitations. This may indicate heart failure.
Sekarang cik boleh baring, ya. Cik boleh baring. Saya akan periksa kaki sekejap, ya. Saya akan tekan.
Then, examine both ankles for pitting edema. To complete the examinations, request to check for patient's blood pressure, temperature, and to perform a fundoscopy if indicated. Finally, thank the patient for his or her kind cooperation.
Sama-sama.